Good morning, I'm Diane Smith, and welcome to Capitol Report Morning Update for Wednesday, May 18th. We're glad you could be with us today. Here's the latest from the state capitol this morning. Details of the signed agreement between the Malloy administration and the State Employees Bargaining Agent Coalition, known as CBAC, are being discussed publicly as union leaders are in the process of briefing their members, to be followed by a membership ratification vote. We now know of the $1.6 billion in concessions. About $450 million of the savings comes from a 2-year pay freeze. It also includes health care adjustments totaling about $391 million, and it assumes that 1,000 state employees will retire by September 1st, and those positions mostly then would not be refilled. The chief negotiators for the Malloy administration and CBAC talked about that with reporters yesterday.
Now, if you'll notice from the agreement, the new retirement rules take effect on September 2nd. So people can retire all the way up to September 1st and still be retiring under the current retirement rules. We wanted to give people an opportunity to make, a decision that really is going to affect the rest of their lives.
But the governor's you didn't have a number for how many you expect to retire before September. Mm-hmm. Does the $1.6 billion in savings assume a certain amount of savings from retirements before September?
Okay. It assumes, thank God I have a boss, it assumes about 1,000 additional employees that will not be replaced.
There were certainly some employees who were hoping for another retirement incentive program and were maybe delaying their retirement. That has happened over the years. It's been a real drain on the pension fund. It didn't happen this time, and some of those people may decide to leave. We don't think people are going to be frightened out by this package. We think that this, in the long run, this package is good for state workers, good for the taxpayers, good for the community. So,
because of the change, there is sort of an incentive for some people to decide before September 1 to leave, and they say more people are doing that.
Yeah, and again, I don't know what is the basis for their expectation. We tried to make sure that people had plenty of time to make a decision, but we don't think people are going to be frightened out. There are lots of people who are going to stay and continue providing the services people need. That's what we're urging people to do. We're not asking people to leave, and we hope they don't.
Now, with the concessions deal, Governor Malloy still needs to fill a $400 million hole in the budget that takes effect on July 1st. He says he'll do that with additional spending cuts and existing revenue, though exact details have not yet been made available. Language in the new budget requires legislative action on any new measures introduced to balance the budget short of the $2 billion in union concessions. In the meanwhile, the governor announced yesterday an $864 million plan to renovate and expand the Yukon Health Center.
This goes well beyond stabilizing who we are and what we are. This is a vision of what the future can bring. And let me be very clear, if we fail to make this investment at this time, if we fail to commit to this program, then we are going to lose ground. We've seen just in the past year that we've lost some ground with respect to jobs moving to Cambridge, Massachusetts, because of the size of the investment made in those communities in and around Cambridge. We can't afford to lose more of those jobs. And we can't afford to lose our opportunity to grow jobs in our state. That is what this investment is about. It's not about beds. And it's not just about research. And it's not just about students. It's about the future of the state of Connecticut and what we aspire to be. And that's why I'm asking the legislature to get behind this plan, to make this commitment at this time so that we can begin recruiting those researchers and scientists, so that we can begin to build up the faculty, so that we can begin to move forward, so that people are clear that Connecticut is making a major investment in its future. And that is what's represented in this proposal.
Governor Malloy says $254 million in additional state bonding will be necessary for this project to move ahead. Now let's bring you up to date on some of the bills that we've been watching. SB 1015, the medical marijuana bill, was passed by the Finance, Revenue, and Bonding Committee yesterday by a vote of 32 to 14. It has now passed 3 committees and goes to the Senate for future action. Also, the Environment Committee became the 4th committee to pass SB 1, a priority bill coming out of the Energy and Technology Committee concerning concerning Connecticut's energy future. The vote there, 19-9. And yesterday, the House of Representatives passed HB 6557, a compromise bill concerning liability for the recreational use of lands, drafted in response to that multi-million-dollar lawsuit against the Metropolitan District Commission by an injured cyclist, which threatened the closure of popular public trails on MDC properties. This bill now goes to the Senate for consideration. Now, of course, one of the biggest issues across the nation in the last couple of years and here in Connecticut is health care reform. The drive to get health insurance for every person in this state reached a big milestone in 2009 when the so-called sustenance bill passed in the legislature. It was vetoed by Governor Jody Rell, but her veto was overridden by the Senate and the House. Well, that set in motion a drive to get the plan formulated, which included establishing a board of directors, 3 task forces, and 4 advisory committees involving more than 160 people. But in March 2010, Congress passed the Patient Protection and Affordable Care Act, which has then raised some questions in Connecticut. How exactly does the federal action affect plans that were already underway here? Well, it appears that there's been a new agreement between the governor and Democratic legislative leaders that will allow sustenance to move forward. And joining us now to talk about how that will work is former Connecticut legislator Juan Figueroa, who is the president of the Universal Healthcare Foundation, and State Comptroller Kevin Lembo, the co-chair of Sustenance Original Board of Directors. Thank you both for being with us, and good morning.
Good morning, Diane.
Juan, would you explain what the original sustenance proposal that was going into the legislature this year would have meant before we get to what the changes have been?
Sure, Diane, and I appreciate the opportunity. Glad to be here this morning.
Thank you.
The original proposal was actually came as a result of a series of recommendations that were put together by the board of directors that you just mentioned. And in essence, those recommendations, which were turned into HB 6305, otherwise known as the sustenance bill, in essence would have made it possible for the state to do several things, one of which was very key, to put together a business plan, which would be the next step, the next logical step in looking to provide a healthcare plan as part of the exchange in the year 2014, which is when the exchanges take place. So one of the key recommendations from the Sustenance Board was to put this business plan together. The framework overall, if I step back for a second, explain Sustenance in the following way. Sustenance is a healthcare plan which is designed to be a nonprofit plan to be offered in the exchange, as I mentioned. That's one part of it. The other part of Sustenance is it's a commitment by the state to integrate and coordinate all the healthcare reform pieces and to better use its healthcare dollars that it spends on its employees and otherwise in maximizing those healthcare expenses. So if you look at Sustenance in those two ways, then the proposal that was put forth at the beginning of this year included a business plan for that healthcare plan to be offered in 2014. And in addition, it offers a series of steps to get the state closer to maximizing its own resources in terms of the money that it spends.
Mr. Comptroller, once that federal legislation was passed, did people then start to think, okay, now why do we need federal and state reform? How do these two things fit together, or doesn't the federal reform kind of take care of us?
Sure. Thanks, Diane. Look, it's a common misunderstanding that somehow we got down this road and then the feds acted, and somehow we could sit back now and let the feds do their thing. In fact, there was an original sustenance proposal that was that morphed over time into this planning board, and that planning board's process worked hand in glove with both the development of the federal law and the beginning parts of the actual operationalizing of that federal law. So sustenance is really built to use all the best parts of the federal legislation and then to do as Connecticut has done, for decades, and that is to innovate above what is a federal floor as described in the federal reform bill.
Now, Juan Figueroa mentioned the spending of the healthcare dollar that Connecticut spends. Of course, there are several different parts of that, including Medicaid, but there's also the state employees' healthcare and the retirees, and that's something that your office administers. So how closely do you want to tie those together, and what kind of authority are you willing to give over in how those dollars are spent?
Yeah, look, there's going to have to be shared authority over these populations as we move forward. But the background is that it's been the Comptroller's office over years under Nancy Wyman's leadership before me that has really innovated around healthcare, has really sort of kept the ball moving forward. There are other parts of government, and I would argue the Department of Social Services is one of them, that may have lagged behind over time. They are coming up to speed really quickly. We have a new administration which is different than the ones in previous years in that they are engaged in this issue. And some would argue for better or for worse, because they're engaged means we're not always going to agree on things, and so it becomes a little bit of a thorny conversation sometimes. So ultimately, $7 billion almost in healthcare purchasing around healthcare in 6 different ways that don't talk to each other is not only a bad deal for those who are being served by those programs, but certainly a bad deal for taxpayers. We need to get our own house in order, and that is part of what the sustenance recommendations do, and we're committed to do over time. There are going to be some silos. There are going to be some, hanging on to your authority and not willing to share among some of these parties, but we're going to work through those and understand that over time, and in a collaborative fashion, we can actually get to a much better result and save some money in the process.
And I'll ask you another question, and that is, how do the recent CBAC negotiations and the results of that affect the timing of all of this? Because one of the issues we've been talking about is pooling state employees and allowing other organizations to get in on the pooling, and I suppose that's right now a separate bill, but maybe merged into the sustenance bill.
Yeah, I don't think it has a negative impact. There will be some pieces of the CBAC and the agreement and concessions that are going to have to be considered, specifically those around benefit design and others. But it's critical that as we move forward with that pooling concept, and that would bring municipalities in, about a year from now, and bring nonprofits that have business with the state in after that, that we are able to offer to these new entities a benefit design that makes sense for them, and a cost-sharing mechanism that also makes sense for them, because we have to assume that not everyone is either going to want to or can buy into the state plan as it's presently designed with its cost-sharing. We've made a lot of progress thanks to our division directors, Tom Woodruff in particular, and I think I should also praise the Speaker for his engagement on this issue. Frankly, there was a time not too long ago, about a month ago, where I thought this was all going south really fast, and if it weren't for the Speaker pulling everyone together, we would be in a far different place.
Juan, I want you